Your last chance to order free COVID-19 tests from the federal government is this Friday. Here to answer your questions is Dr. Shira Doron, the hospital epidemiologist at Tufts Medical Center. Great to see you, Dr. Doron. Thanks for joining us.
Great to see you.
Well, Dr. Doron, we know you get plenty of free tests at work, but for the rest of us, as you know, every home in the U.S. is eligible for 3 rounds of free tests. So far, since January, more than 600 million kits have been mailed out. By any measure, it's a pretty popular program, but now no more funding for it. So in your opinion, what impact could the decision to end this program have on public health here in Massachusetts and then across the country?
Free testing is still so critical. We know that over the course of the pandemic, those who have been most affected have been those who are least likely to be able to access testing. The only way to get the highly effective treatments that are available for those who contract COVID-19 is to know you have it by testing. I'm not sure the system of ordering those 3 rounds of tests online was the most equitable or cost effective, but I am sure that a lack of access to free testing will be associated with increased morbidity and mortality, and that it will disadvantage the already disadvantaged. There are other ways to get free tests, and I think those need to be scaled up as this program is phased out.
Okay, so the state we know collects data on the number of positive COVID tests, assuming you get the test. But earlier this summer, health officials began sharing the information on a weekly instead of a daily basis. In your opinion, is the data even still helpful, considering not everyone's reporting their tests? Are there other ways to track how the virus is spreading or changing, especially as we enter the fall?
Yeah, well, we don't make decisions based on day-to-day changes in the data anyway, so weekly is more than enough. And as you said, because most testing is now done at home and therefore it doesn't make it into the dashboard, that part of the dashboard is of limited utility. So we're paying a lot more attention to other things like the wastewater levels, our own hospital employee illness rates, and the number of people hospitalized for COVID, as opposed to those who are in the hospital for other reasons who happen to test positive, which is an important metric that Massachusetts started monitoring during the winter based on research that I and others had done on the utility of that metric and which other states don't track.
All right, so as you well know, you live in the suburbs, I believe. Kids return to the classroom this week at hundreds of local schools across suburban Boston. Many won't wear face masks, no staying 6 feet apart. That's all gone. So what would you want parents to know about their kids' risk for COVID headed back to school, at least in the first couple of days?
Well, we're in a completely different place than we were this time last year, and like a totally different planet than we were this time 2 years ago. And that's because our children and school employees have layers of immunity from vaccines and or infections, and because we have highly effective treatments for anyone high risk who gets infected. And we even have an effective preventative antibody therapy, Evusheld, for immunocompromised people who can't respond well to the vaccine. Now, children have always been at low risk for severe disease, and even more so now. And that's why I think it's the right time to refocus our energy on giving children the normalcy they deserve and on tackling the learning loss that they've experienced.
Okay, well, to the other illness people have been concerned about lately, lots of parents have questions about monkeypox as kids go back to school. One local superintendent says she's actually requiring stricter cleaning measures in the athletic and wellness areas to try to prevent any spread. Do you think more communities should take steps like that? Should parents be worried?
No, I don't think so. The CDC actually released new monkeypox guidelines for schools, which essentially say that no special precautions should be taken in schools. Given the way monkeypox spreads through close, intimate contact, we can expect some sporadic cases in school-age children, but not ongoing spread or large outbreaks. I'm not too worried about surfaces in athletic and wellness areas, and luckily it appears that the outbreak may be slowing down across Europe and much of the U.S.
All right, Dr. Shira Doron with your back to school guidance. Dr. Doron, good to see you. Thanks for your time.
You too.